Okay, this morning we're going to be talking about Lovenox and some of the, I'm going to demonstrate or explain. Lovenox will come in a box like this, and it will be labeled, and so this particular one says Lovenox 40 milligrams per 0.4 mils. And so we will do our first two checks by just looking at and verifying on this right here, and of course you're checking the date and expiration date and stuff like that. It's hard to see. I mean, you can see that there's fluid in the syringe and it also has a bubble, okay? But it's hard to see the markings on there with it like this. So the manufacturer should guarantee that there is 40 milligrams or 0.4 mils in here. And we will be, because these are expensive, so we're just going to demonstrate those to you. So on my third check, after I've done my third check, I'm going to go ahead and open it because you got to scan it, okay? And I'm just going to show you this particular syringe, okay? So when you go to take this off, it is like a rubber band and it's very difficult, so you've got to make sure you've got a good grasp on it when you pull that off, okay? But before I do that, I can verify, because there's little markings on here that says 0.4, 0.3, 0.2, 0.1, and so I'm going to make sure, because there is a bubble in there, and with Lovenox you leave the bubble. It specifically tells you that you will leave the bubble. So I am looking at the fluid line. So I've got the bubble up here next to the plunger, and I'm looking at where the fluid line is according to my mark. And so this one is 40 milligrams per 0.4 mils. So I would need to make sure that my fluid line was at 0.4 mils, okay? So we always want to make sure when we start to give that the bubble is at the top. Now the other thing with this is, so when we take this off and we're giving this, you can see that this has a square top here. And so when you're giving this, you're going to make sure that you push the plunger all the way down so your thumb is up against this edge right here. Just like if you were doing it against this part right here. You push all, that way you know that all the medication has been injected. So once you inject, you take it out, you're going to have your finger still on this, so it's going to be up against this. It's like a little square here, and you're going to keep pushing, and you want to make sure this is away from anybody's face. So after we've taken it out, I'm going to keep pushing my thumb so this goes inside this square, okay? So we keep pushing, and what happens is this is spring loaded. So there's a spring in here. So as I keep pushing, once I've injected it and take it out, then this is going to deploy the safety device before I take it to the sharps container, okay? So the safety deposit is, you keep pushing, deploys that little spring, which then puts the safety shield over the needle before I go to the sharps container. I have seen where with Lovenox, they've got some that are 80 milligrams per 0.8 mils. And a lot of times, based on if they're going to have a hip surgery or maybe knee surgery, or maybe they've had some major abdominal surgery, heart surgery, then you will see that the calculation is they want a certain amount of Lovenox per kilogram, okay? So you've got to make sure that you know your conversion, okay? So we would need to know how much of this we're going to give per kilogram. I have had it where we had an 80 milligram in a 0.4 or 0.8 mils, and we were to give 60 milligrams, okay? So if there's 0.8 mils is 80 milligrams, then we would have to calculate how many meals do I need to give, or how many do I need to get rid of, okay, to make sure I give the correct amount. So after we've done our verification, then you will need to take this off and be very careful to expel however much you need out of there so that your fluid line is at the correct dose, okay? And then you're ready to go give, okay? So you never want to try to calculate and make sure, because you're not going to give the correct amount, so you need to dispel, because sometimes they don't come in a 60 milligram, they come in an 80 milligram, okay? So we would need to do our calculations based on if it's how many milligrams per kilogram, and then what is in our syringe, how much do we need to give. So we maybe, I keep dropping that, maybe need to expel a little bit of the fluid to get so that the fluid line is at the correct, and it starts from here. 0.1, 2, 3, 4, 5, and so you would just move it down fluid line with that, okay? So calculating that. Again, this is very difficult to take off, so you got to have a good grip, so be prepared for that. And then again, you've got to push that through on your, now sometimes the pharmacy will have already done that calculation for you, but you've got to make sure, because you're the one giving it, that you have made that. Again, so we'll do 3 checks on the package, and then when we do our 3rd check, we would scan, and then we also, once we get it out, we're going to make sure we verify that that amount is there. Okay, so that is what it normally looks like, but occasionally, for our purposes, we will be having it in a pre-drawn syringe, so it will already come pre-drawn, and so when you get it, you'll have it like this, and we'll talk about that in the process. So we're going to give our Lovenox. So the first thing, again, I'm going to go to my I'm at my nurse's station, and I'm going to go ahead and pull up my file, and I'm going to start with my doctor's orders, because we need to verify that the MAR is correct with the doctor's orders, okay? And so I've got Anna Taylor, date of birth, or Dr. P. Potter, date of birth 4/24/1991, medical record 3335899, no known drug allergies. Admitting diagnosis was uncontrolled diabetes 2, right hip replacement. And so I'm just going to verify that on my MAR. I've got Anna Taylor, date of birth 4/24/1991, medical record 3335899. Dr. Potter, no known drug allergies, uncontrolled diabetes 2, right hip replacement. Okay, so go back to my doctor's order, so that matches. Now, if we were doing, like we were talking about with kilograms, if our dose is based on kilograms, we also need to note on our record how much that our patient weighs, okay? So most of the computers have a screen across the top that will have the weight, and of course this weight is 256 pounds, so we would need to convert that to kilograms before, if we were going to be doing it so many milligrams of Lovenox per kilogram. In this case, it is not, but if it was in weight, we would have to convert that to kilograms, okay? So I'm going to go back to my doctor's orders. Anna Taylor, date of birth 4/24/1991, no known drug allergies. Again, I'm going to check to see what I need to know about. We're admitting the patient for uncontrolled diabetes 2, right hip replacement. We're going to do vital signs Q4 hours, diet 1800 calorie ADA diet, activity out of bed to chair BID. The labs, we have our CBC with DIF, CRP, platelets, renal, hepatic labs, potassium, PTINR, and AM, and then AccuChecks before meals and at bedtime. So I'm going to be giving and then this is more labs here that just duplicated because they want it to be done again. Medications, so Now I'm going to start my med check. And so I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Lovenox 40 milligrams subcutaneous daily. Okay, I'm going to go to, well, let me start because I'm checking my MAR. So the first one is regular insulin 8 units mixed with NPH insulin 12 units subcutaneous before breakfast and evening meal. Okay, so I'm going to go to my MAR, and I've got Anna Taylor, date of birth 4/24/1991. No known drug allergies. I've got my regular insulin 8 units mixed with NPH insulin 12 units subcutaneous before breakfast and evening meal. It's scheduled for 9 o'clock and 1800, and I can see that someone has already given the 9 o'clock dose here. Okay, and so that matches. I'm going to go back to my doctor's orders. I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. My next med is Lovenox 40 milligrams subcutaneous daily, and I'm going to go to my MAR, and I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies, and I have Lovenox 40 milligrams subcutaneous daily. This one daily one time, and it's supposed to be given at 12 o'clock. Okay, go back to my doctor's orders, and so that was the last medication that I have done. So I'm going to go back to my MAR, and so I have made sure that those matched, and I'm going to go ahead and up here at the verification put my initial, my J. Buckskemper, and my credentials. You would put your credentials, okay? That I verified that this MAR matches my doctor's orders, and then I'm going to go back down to here, and so I'm going to put my J. Buckskemper, and then I'm going to put my title. Now, typically this is done first thing in the morning when you get to work. You're going to be verifying your MAR to your doctor's orders, so that throughout the day you are just working off of your MAR, but you're always checking to make sure there hasn't been any new meds through your shift. Okay, so at the beginning of your shift, through your shift, has there been any new meds? And if there's a new med, then you would have to check the MAR to the doctor's orders for that particular med. Okay, but so we've verified that our MAR is correct with our doctor's orders. Since we're giving the 12 o'clock and we're doing the Lovenox, I need to make sure that I've looked at my complete blood count, I've looked at the platelets, okay, and that we're going to be following up with a PT-INR, so we're going to be looking at bleeding time with that, okay. So once I've checked all of that, I'm going to go ahead and I have put my initials down here so that anybody that sees JB up here, they know who JB is, in case there was any questions on that. And I've also verified that this is correct. So I'm going to go ahead and close my computer down at the nurse's station. Now I'm going to go to the med room, okay? And when I walk into the med room, I'm going to go ahead and do my medical hand wash. The nurse, as a student, the nurse will have pulled your medications and put them in a drawer for you. So we need to find our drawer, okay? And we need to make sure that they've pulled those meds. And then I'm going to go ahead and start my first and do my 2 checks in the med room. So I'm going to go ahead and pull up my chart, okay? And start my checks. So I have Anna Taylor, date of birth 4/24/1991, no known drug allergies, Lovenox 40 milligrams subcutaneous daily. I'm giving the 12 o'clock dose. In my hand, I have Lovenox. It's 40 milligrams per 0.4 mils, okay? Expiration is 3/1/2026, so it's 40 milligrams, Lovenox 40 milligrams, that matches. It's 0.4 mils, so I need to make sure, so I'm going to turn it upside down. I'm going to make sure my bubble is at the top, okay? And I'm going to make sure my fluid line is at 0.4 mils, okay? And it is. So that is my first check. My second check is identical to that. I have Anna Taylor, date of birth 4/24/1991. No known drug allergies. I have Lovenox 40 milligrams subcutaneous daily. I'm getting the 12 o'clock dose. Now this one doesn't, since it's already pre-labeled and it already has the amount in there. It doesn't have the time, but on the first, we had read that our time was the 9 o'clock dose, okay? And so we'll start our second check here. So I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. Lovenox 40 milligrams subcutaneous daily. I'm giving the 12 o'clock dose, okay? My syringe says Lovenox 40 milligrams per 0.4 mils, so 40 milligrams matches my Lovenox there. Expiration 3/1/2026, okay, and it's in 0.4 mils. So I'm going to turn it over, make sure my bubble is at the top, and I have my fluid line is at 0.4 mils, okay? So that is correct, and this is going to be given subcutaneous, and it's going to be at 12 o'clock. So we've got our second check done, and I'm going to go ahead and close out my my computer. Okay, and as I leave the med room, I'm going to go ahead and do a medical hand wash. And we're going to take our meds and go to the patient's room. So I've left the med room. I'm going to go to my patient's room. I'm going to knock. Good morning. It's right before lunch. So my name is Jan Buxkamper. I'm a registered nurse, and I'm going to be giving you your 12 o'clock meds. So let me pull up your file here. Okay. And so can you tell me your name and date of birth? Anna Taylor, date of birth 4/24/1991. Dr. Potter. And we've got Anna Taylor, date of birth 4/24/1991, and Dr. Potter. And are you allergic to any kind of medications? No known drug allergies, not any? Okay, and that's what we've got on our file. And so I'm going to go ahead and put my scan here. And we're going to scan your armband, okay? And 3335899, 3335899. Okay, so that matches, okay? And so I'm going to go ahead and do my third check on my medication, and then we will explain what we're going to be giving you, and we'll explain where we can give this, and then we'll go ahead and give it for you, okay? So got name, date of birth, allergies, name, date of birth, and we scan the patient's armband. Okay, so I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Lovenox 40 milligrams subcutaneous daily. I'm giving the 12 o'clock dose. In my hand, I have Lovenox 40 milligrams. It's 0.4 mils. Expiration 3/1/2026. Okay, and so that's what's in my syringe. I'm going to turn it over, and I'm going to make sure I've got that amount. So I've got the air bubble at the top, and my fluid line is at 0.4 mils, and we're going to be giving this subcutaneous, and it's going to be at the 12 o'clock, okay? So I'm going to go ahead and scan my medication, okay? And so it scanned it, and we've got the right one. So now I'm going to go ahead and get ready to give my medication. So we're giving you Lovenox. This is a anticoagulant. It's given to help prevent what we call DVT, deep vein thrombosis. And so one of the reasons why we give it is because you aren't getting up and moving around a lot right now. And so what happens sometimes is Some people might tend to have get blood clots in their calves, and so this medication is going to help prevent those blood clots from forming until you get up and you get moving around. So our goal is to get you up moving around as quickly as possible, okay? So some things we've already checked your labs, and all your labs, your PT was good, or your platelets was good, your CBC was good. Is sometimes you might have, it could cause you to bruise easily, but it may be when you're brushing your teeth, if your gums bleed, we need to know that. But we'll get you a soft bristle toothbrush to use with that, okay? Also, we're going to be looking to see, are you having any kind of bruising or anywhere, maybe even some black tarry stool. So if it looks kind of black and tarry, we need to know that as well, okay? And so mainly we're just kind of looking for the teeth or the gums and using a soft bristle. This morning when we did our physical assessment, we did go ahead and check your calves, but we'll check them again. So we want to make sure that they're the same size, okay, and I'd washed my hands when I came in. And we're going to make sure, do you have any tenderness in your calves? Okay, and earlier when I was looking, I didn't see any redness back there, okay, and I don't see any swelling, and you're not having any tenderness in there, okay, and your calves are the same size. So we had checked that when we came in. Get that off your toes a little bit. So we want to make sure that if you do start having any problems with that, let us know. Some other things that you can do while you're in bed till you get up moving around is just do some feet pumps, okay, like that. That kind of helps keep the circulation going, but we're going to be getting you up out of bed twice a day sitting in a chair, but we're going to elevate those feet so you're not sitting with your legs bent, okay? All right, so Lovenox, like I said, it's a anticoagulant to help prevent blood clots from forming, typically when you're laying in bed for a long period of time. With Lovenox, you want to, and we provided for privacy, we are going to give what we call in the love handles, okay? So we're going to stay in the lateral aspects of the abdomen on the sides. So we can do it in the right upper lateral quadrant or the right lower lateral quadrant, and same thing over here. Left lower, left upper, and so it'll be specific as to I'm doing it. So we want to make sure we're staying on the lateral sides, and then we can also give it in the lateral, in the posterior as well. So we would assess a lot of times if you've been having these, we would look to see, and obviously we're going to rotate sides. You know where you got it last? It was on the left lower, okay, and so we're going to give it over here on the right, but I'm going to be looking to see if you've been getting these, you may see some little bruising around where those injections are, so that would also let us know where we're going to go, okay? So we're going to give it over here into the right lower lateral quadrant, okay? And this one is just going to be given daily. That's all they want it for you today. So we're going to be giving this at noon, or at 12, which is, okay. I'm going to wash my hands real quick and put my gloves on. You always want to give with gloves on. Okay, so we scanned our patient, we scanned our med, we verified it. Do you have any questions? Okay, so this is a sub-Q, and so this one is at a 90-degree angle, okay? And it's deep sub-Q. You want to make sure that you hold the pinch the entire time, okay? Okay, so we're gonna clean from the inside out, making sure we're not going over that. We're gonna take that out. Okay, keep our pinch. We're gonna go at a 90-degree angle, 1, 2, 3, all the way. Go ahead and slowly inject that, actually injecting the air as well. Okay, take that out, release. We're going to deploy our safety device, and we're going to take that to the sharps container, okay? And we're just going to assess. We don't ever massage that area. And I'm going to take my gloves off, glove to glove, skin to skin. Now, with Lovenox, the patient needs to be in a low Fowler's or even laying flat. You don't want them sitting up whenever you're giving this. So the best position is now, if they were contraindicated in laying flat, but we want to be more at a low Fowler's when we are giving Lovenox, okay? And so that specifically is when you're looking your med up, it will tell you what position that you need to have your patient in, okay? And so if I was working with my patient, I'd have that patient up a good working height, so I could give that, but we didn't. We gave it up here. So if I raise the bed up, I'm going to put it back down in the lowest position, side rails up ×2, make sure the wheels are locked. We've got the call light within reach, okay? And I need to go ahead and document. So I've got my Lovenox, and in my 12 o'clock here, I'm going to put my JB, and then we gave it in the right lower. I'll get my fingers on that. Lateral quadrant. Okay. Now also, so that tells where we gave it. So in case the patient wasn't able to tell the nurse tomorrow, if I'm not here tomorrow, where the last one was given, they can always come back to the MAR and they can know exactly where the last one was given. And again, we're going to rotate those sites. And so in the hospital with their computer system, a lot of times they have a drop-down box, and you find specifically, and it will have right lower lateral quadrant, right upper lateral quadrant, and so you have to specifically pick that. And then in another spot, we need to make sure that we are documenting that we educated the patient, and that if they had any questions or did they understand what was being given to them. And so we would document all that. So once we've got that documented, then we're going to save our MAR, our press that we have given, okay? And then it will show on the main page of our MAR that med has been given, okay? So we document after we've given, and then we make sure we document so the next person knows that it was actually given, because it's noon and I may go to lunch. So once I've done that, I'm going to go ahead and close my chart out, and I'm going to make sure that my patient doesn't need anything. It's 12, so your lunch will be coming in shortly, so we'll get that to you. Do you have any questions? Okay. You don't have any questions? All right, well, we'll get your lunch here shortly. And so as I leave, I'm going to go ahead and do my medical record. Again, my bed's in the lowest position, side rails up ×2, the wheels were locked, call light within reach. All right, if you don't need anything, just call if you do need something, and I'm going to leave the room.